Hi, Mark here, coming at you a little later than I had planned to. I was going to do this recording after my first treatment of proton beam radiation treatment for prostate cancer. Instead, I have waited until I'm all done. 44 sessions. I actually ended a week before last. And they're all pretty much the same. Basically, you show up, you drink your water, 24 ounces of water. I had to be done by 35 minutes before my scheduled appointment. And so for that 35 minutes, my bladder would be filling, and then the techs would come get me right on schedule, take me back to the room where the treatment would take place. You start by just changing into a hospital gown, then you lie on the table, and the initial treatment, they have to line everything up. They've got all these lasers and everything that help them line the machine up for where they want to put the beam into your hip and or hips. And at the Chicago Proton Center, they just set that one time, and then the machine itself knows where the settings are supposed to be every time after that. And so it's a very quick process. You go in, it takes maybe a minute for them to actually shoot the beam at you. One day they're doing your right hip, and the next day they're doing your left hip, and back and forth and back and forth. It went for 44 days, and you feel nothing. You feel nothing. They might as well be shining a flashlight on you. It's even to the point where I joked a couple times, are you sure this is really doing something? Because I can't tell if this is doing anything. It has left a couple of maybe silver dollar size circles on my hips from the beam, I guess, burning my skin a little bit. I haven't felt any pain or itching or anything from that. So it hasn't really been a problem at all for me. The only side effects I've had so far, fatigue starts to set in along the way as your body is trying to rebuild the good cells that do get hit along with the process of hitting the cancer cells. And the last couple weeks of treatment are the worst as far as that goes. I've been pretty fatigued. And even in the wake of it, I'm still facing fatigue. And some of that might be from the Firmagon. So if you're doing Firmagon or Lupron along with radiation therapy, you get a double whammy of fatigue. But, it's not unbearable. And the other thing I experienced was increased frequency of urination, going from waking up one time a night for as far back as I can remember to getting up 2 or 3 times, and once in a while 4 times. That didn't last very long. They can put you on medication, and sometimes just a leave will help with that. And so, a small price to pay for getting rid of cancer. It's very temporary. There's a possibility, I've heard, that incontinence could become an issue down the road, but that's in a small percentage of cases. It's not nearly the percentage and the certainty of having to deal with it to some degree as you would have with the surgery. So that hasn't been an issue. As far as sexual function goes, it's hard to tell if the treatment has had anything to do with that. The Firmagon itself blocks testosterone, and so that kind of shuts you down there for a while. I'm off the Firmagon now. My last injection was a month ago. I've been told it takes as long as you were on it. That's how long it takes you to get back to full strength testosterone. So I got a few months to go. So that's all I can say about that. So hopefully this has been helpful. I really, it's not a painful process at all, except for the insertion of the markers and the separation gel. And I think that's probably back in videos 2 and or 3. I don't know, somewhere in there. That was a painful 45 minutes. One of the worst things I've ever been through, but when it was over, it was over, and I walked out and I was fine, and I was all set for the treatment. So, like I've said with so many things along the way, if you gotta go with any kind of discomfort, any kind of time commitment, anything that messes up your normal flow of life or whatever, you're trying to get rid of cancer, or at least subdue it, and so it's worth it for all of that. I would recommend this treatment if you have the option of doing it. I can't give you a recommendation on the effectiveness of it. Everything I've read says it's as effective as surgery and traditional radiation therapy. It's just except for the one prep time, it's very non-invasive, and so. My next step is to wait to 3 months after the fact, where I will have another PSA test done and do my follow-up. And that's where the tale will start to be told. Not really anything to do until that happens. And then there's follow-up that's to take place every so often, maybe for the rest of my life. I don't know. Just keeping an eye on it. But there you have it. I hope this has been helpful for anybody who's trying to decide whether or not to have proton therapy treatment for prostate cancer. And that's been my intention, to give you a taste of what it's like. So there you go. All right. Okay. God bless. Bye.